Hips don't lie, right? Because they don't. Because when it comes to low back pain, when it comes to core strength, hamstrings, quads, glutes, all this stuff, hip flexors, okay? One thing super, 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 super important, okay? The psoas muscle, P-S-O-A-S, the psoas. So you have about 2 of those. I could show you on a diagram if you really want to, but maybe we'll leave that for another time when we dive into the hip, but I'll just kind of overview it. The hip flexor attaches on the inner thigh, about inside here. I'm not sure if it's called a greater tubercle, whatever it is, there's anatomies, classes that I used to have. Inside thigh, now imagine this. It lines it goes all the way up, lines the inner bone. So if you're sitting at home and you're watching this like this, find that hip bone, try it out yourself. Find that hip bone, just that bone right there. Yep, as soon as you find it, kind of bend forward a little bit so you can actually create some slack. Pull your fingers into that bone like this. You're grabbing on the inside muscle, it's gonna hurt a little bit. But try to grab, don't go too far in, but just enough so you can actually grab that muscle. So see right here, watch. Watch out for a second. Where's your hip bone? Oh, where the hell is your hip bone? Right there, so I would go in here, all right, like that. Literally curl your fingers on the front of that and then on the inside of it. And you don't have to go too deep, I just wanna show you kind of the reference point of where it is. Okay, so when you find that right there is called the iliacus, which is part of the psoas muscle. The iliacus simply lines the ilium bone, but it's on the inside of the hip. So it goes from there, lines the inner part of it. That's the only place you can really touch it. You can really kind of get to it in here too, but that's where I treat it. Okay, so that's how you could treat it, and I'm gonna teach you how to treat that. And that's for low back pain, valgus knees, bad hips. The hip flexors are one of the most important muscles for athletes, for anybody, especially if you're sitting for longer than 2 hours in a day. That muscle goes psoas major, goes all the way up and attaches onto your low back at about, I believe it's T1, don't quote me on that one, but it's one of those ones, okay? It's way at the low back. So imagine that, what did I just say? I just said at the front of the body, lines the body at the back of the body. So that muscle, imagine if I'm sitting. Imagine I'm sitting for whatever.
9 to 5.
Dude, 9 to 5, but we were in school for how long? Grade 12, oh my God, and then university, and then all the times in university, and after university, even now, we go home. Like think about this, like in this position, without even talking about that, think about this, like 90 degrees. You sleep in a 90-degree angle, you get up onto your bed 90 degrees, you go have your breakfast in a 90-degree angle, you get in your car at 90 degrees, you get in your desk at 90 degrees, go back in your car, go back to your home, do that for 20 years. When do you ever drop past 90? Almost never. You're never required to. And what did humans only do before that we learned in society? Down here. This is where we used to do everything. This is where we used to poop. This is where we used to make our food, clean our clothes. This was a normal human position. Now, 99%, almost 100% of people can't get into this. Like 98%, I'd say, can't get into this position. Try it out.
Yeah, that's true.
Try it out. I just want to see, like.
I haven't warmed up here, but
yeah, just to see how low you can get. Now, you notice that the round. I'm not trying to.
Oh yeah, I'm rounded.
See the roundness of that? I can tell you why that's happening. Try that here. See that? See the roundness of his back there? He's at least he can get there. The point is that he can get to there, right? Which is super, super important. Most people can't even do that, man. They get down to here, and then they go like this. And they fall back, literally fall back, right? So the hips need to drop down past 90 degrees. If you don't use it, you lose it, right? If you don't use it, you lose it. So if you don't use the range of motion, you lose the range of motion. This hip flexor, imagine this right now. Imagine this is the tissues that are going along my hip. Right now, if I'm sitting in this position, my nervous system is locking this tissue so that my muscles don't have to hold me in this position anymore. It's less effort for the body. So what happens when I go to stand up? It wants to stay locked, it's gonna hold me in that position. So if it holds me in that position, what's the next thing to do? If I'm trying to stand up, I can't, I gotta arch. You have to arch. You have to arch. You have to arch because your hip flexors are here. And if you don't arch and you lift somehow, something else is gonna change. Something else is gonna change. Remember, it's attached to the low back, way over here. So it's pulling on your thoracic spine. It could be pulling it more this way, pulling you into a scoliosis, pulling you into our anterior rounded shoulders, and you might have this, but it looks like this. You don't notice it, because your body's so efficient, because you won't even know, it'll be like this. You'll be like, oh, I have nothing. But you have like all this stuff all happening from the inner hip, pulling your body like this. And then you see a lot of people, I used to stand like this, a lot. Like I still kind of stop myself from doing it, but look what's happening. Look at my foot. It wants to go that way. Right, and when my foot goes that way, my hip goes wah. One of the biggest tests for that is called Trendelenburg's test, which is one of the massage therapy assessments. So you put your hands on the wall and you lift up one leg and you're looking at this side, but you're lifting this leg. Okay, so when I lift this leg, does everything stay still? Relatively, right? Now, if this was weak, what'll happen is if I lift, it'll bow out. This muscle is too weak to actually stabilize the hip. So it'll bow out. So, chicken or the egg, is it the foot that collapses, that weakens the thing, or is it a weak glute that collapses the foot? I believe it's both. I think it's a structural thing. That's why we can't be training in such a segmented way. Okay, so if you want to come a little bit closer, I'll show you something here. Here's the bone, right? Yep. Here's the bone right here. Found it, right? Once I find that bone, now to create slack, I simply lift this leg, slowly dive. If you're doing this to your partner or your friend, just be nice. and try not to get that person to laugh too much because it'll kick them out every time. And if it hurts, ease off. So I try to remember I'm diving in and I'm going in. I'm not going down. Big difference. So I'm going to find that bone. I'm going in a little bit and get him to breathe. So take a deep breath. As he exhales, I'm going to dive a little bit deeper and then I'm going to pin it and stretch it. Now, it may not seem like much, but when he stands up, he'll automatically feel the difference. Now, when I do this, I go way out here. I go way out here. If you really want maximum benefit, you grab the whole leg, you pull it out of the joint a little bit, then create the motion. Okay? How does somebody do that on their own? That's the next question, right? I grab a hammer. I'll grab the hammer, but I'll grab the head, and I'll put the handle right in that spot.
Okay.
Like this, in that direction.
Yeah.
While my leg's like this.
Crazy. So you're going here.
Literally grabbing the handle like this, pushing it in there,
and then pulling.
and then you just do this.
Yeah.
So watch. This is called ART, by the way. Most chiropractors with $5,000 course, they'll charge you for, where the hell did it go? Most people, $5,000 course to teach you this. It's called myofascial release through massage therapy. So all I do is I pin it, and then you just extend that leg. He's gonna feel a little click probably. Now push the whole leg down into the table, activate the reciprocal muscles, which is the glute, and then relax. Okay? So what I just did, he can do that to himself. You just pin it down, stretch it out. You get up and stand, see what that feels like just from doing that. I didn't even do it, by the way.
Yeah, no, it feels good.
Yeah.
I want to see what my depth is now.
Oh yeah, your back, okay, I could tell your left side.
Yeah, it is better.
I swear to God, I don't know if you noticed that. Maybe come on my angle, but try that again. Oh my God, man. Oh my God, it's so obvious. So let's do both sides. You can even come on this side. Maybe we can record this. Now remember, this type of activity, ART, myofascial release, do it. That's what we do as physical therapists. There's nothing else we do, whether it's cupping, scraping, whatever. It's basically myofascial release, just glorified. Okay, so you can do this on every part of your body, the toes, the hand. As long as you know how to shorten the muscle, pin it, the bulk of the head of the muscle, and then strip it. That's it. That's what every great physical therapist knows how to do, but just at a certain degree, and they know how to target the muscle properly. So now we're gonna do it actively. So now, if you have a friend at home and your hand hurts, well, just use two hands, right? So you can get them to relax a little bit, relax that completely. And hold that for there, yep. Now I'm curling my fingers in again, and then go ahead all the way. This time, try to really go past the table, so straighten out. Yep, feel that little click there. And then push that whole foot down. I take it one step further, I put my foot underneath his foot and activate the glute, perfect. All right, now lift it back up. We'll do it one more time, okay?
Oh, yeah.
Oh my God, dude, that's like and most people would be like, oh, I can't squat because something in the backside is restricting me.
Yeah.
I don't know, man. It starts at the front, goes to the back.
Yeah.
So it's tilting and causing this to happen. When I release this, the pelvis corrects itself.
I know there's even things where you just lie here, right? For instance, that just will stretch it if you're in a horizontal position.
Yeah.
So that's what you could be doing at home, right?
Move down a little bit. I want to show you something. What you just said, I'll show you how to actually do it effectively so that your nervous system can actually adapt.
Okay.
So stretching doesn't work.
Okay.
I know you're gonna hate that. Most people are gonna hate that. But it feels good and you might get maybe 5 to 10 minutes of a nervous system kind of like confusion, and your nervous system's like, oh, you helped elongate. That's not how it works, okay? Joints, muscles follow joints, okay? But if we can train it, we can train it at end range. For example, if I push this down like this, especially if I curl his foot in a little bit, okay? And I'm pushing down. So he's feeling a deep stretch here or here? A little bit of both?
No, to the top.
Ah, perfect. Some people, when you do this, they'll feel it here because they have something locking up here. So it's like you have to start with this, then you got to move up. Anyways, here. Now, what I'll get him to do, so I'll hold this for about 30 seconds usually, right? You can do this to yourself. If you grab a dowel or towel or like a band, hold your ankle, pull it up. That's what I do to myself. Okay? So from this position, I'm gonna get you very gently, give me about 30–40% of your power and lift up the knee. So he's now gonna engage the core, push up, and he's gonna hold that for 5, 4, 3, 2, and relax. When he relaxes, I actually can go deeper into the stretch. Okay, because now what that did is it almost like kind of said, it gave the nervous system a new prompt, and it said, okay, now I can release now. Because it's an interesting way, it's a nervous system thing, it's not really a muscular thing, so it's hard to explain within 2 seconds. But now from this position, if I wanted his nervous system to keep this, I would actually, from this position, it might be weird, but use your glute to push the leg down. That's gonna be weird. Yeah, like that. Is your glute firing? Yep. So when his glute is firing now, he's at end range, his nervous system is learning how to keep this tissue, and this tissue now is learning how to adapt to keep the leg in that position, right? Instead of just stretching this stuff, which doesn't do anything. This muscle actually keeps it there. So, and relax. So now, he can go a little bit deeper. This is passive. I'm just doing it because that's what an external therapist do. When you're doing this on your own, you'll feel it and you'll notice the difference. So this is called PNF, proprioceptive neuromuscular facilitation. And that's basically what I just showed you with the pushing and pulling, that's all you need to know. Okay. The other thing is the extra thing that I'm gonna show you how to do on the whole body, which is the FRC stuff, which we'll talk about. Let's see his range. All right, so that's where it kind of slows down, right? So remember where this angle is on the camera, right? Okay, now watch this. Right? I don't, like, how does that happen? Like literally the camera guy right now doesn't know what he's looking at. I don't even know what's happening. And it's like, wait a minute, how did that happen, right? Like, it's kind of magical, right? So if I go here, it actually did kind of, this actually did kind of increase just from doing the other side, right? But this time, watch this. Flick. Now how did that happen?
Now wouldn't that be the priming, like, so the muscle the first time you did it, priming it, getting
nervous system.
Right? It's preparing your nervous system.
That's it.
Yeah, okay.
So that's how fast your nervous system adapts to a new movement. That's how fast it does it.
So it's not specifically the flicking of the...
No, it has nothing to do with that. So be careful with magic tricks. They're not magic tricks. None of this stuff is magic tricks. Your body is amazing at adapting. You just have to put it in the right positions and give it the opportunities to do that. And if things are in line, just like if you build a building, the foundation has to be strong. So when it comes to the hip flexor is super, super important. Now glutes, okay? Hip flexor and glute, they're almost like bicep and tricep. Okay, when bicep curls, tricep has to elongate. When tricep contracts, bicep has to elongate. Now, that's how the hip works. Okay, so if I'm always in a constant shortened position and I'm coming up and it wants to stay here, I'm never really fully getting glute activation when I'm pushing off and sprinting or when I'm jumping. So hip flexors affect your jump, your run, everything. That's why when you kind of correct that and you elongate that, you can get really down into a squat. You start changing how your feet work. They say the psoas muscle is like the spiritual muscle of the body. That's why people sit in these like lotus positions all the time, because like that's where your breathing comes from. That's the center, that's the root of where you are, that's where you're at. And a lot of people can't even get into this position in general because they don't have, the hip flexors are so jammed that they're probably like this, right? So that's another thing. So the glutes, one big thing about that, so you have glute max, big muscle, glute min, glute med. In the glute med, we talked about the Trendelenburg test where you can actually find out if people are standing like this, how weak that muscle is, but when it's strong enough, it'll pull it up. How do you strengthen it? Bam, right? We showed this a little bit, but I want to show you another one just from sitting. So from this position, I do like these bands if you're a beginner and you don't do this very often, but if you're strong enough, you want a band that's heavy because I could do like the whole rack out there. So it's a lot of weight, like I'm talking 200 pounds and I'm pushing out. So just this activation alone, I'm sitting up straight, I'm not rounding, I'm sitting up straight, that I feel only there. I could feel that like firing like crazy. Now if you wanna you could do multiple sets, 3 sets of whatever. I like to just do as much as I can until I start to feel that burn.
You do it seated?
I do it seated and standing and laying down and jumping, and I do it in all forms. And then I'll stand up like this. I'll even do this, right? Single leg. You can even go back. These are more activation exercises. They're not like workouts, but if you load it up, you could really get into it. But this is something that I do even to check my squat, just to make sure my knees are out. Yeah, right? Because when I was a trainer, or when I do my thing with it, I grab a band and I wrap it around one knee. Like if you're in a session, and I just kind of pull the knee a little bit like this while they're doing like a one-legged lunge, just to make sure when you're going down, you see that big toe. Super important.
Knee over top of that big toe, right?
Yeah, but if I'm going down to my lunge or my squat and I see this happen and I can't see my big toe, that's the indicator right there. Try it out and just see what you're noticing. Don't try, you tried to fix it. I saw that. Yeah. Band. Look down. Right. So see how now come over here with that camera for a second. Hold that for 1 second. See the angle? See how it's going this way? What I would do is I want his knee to be here, right? And then when he looks down, he should see this line right here, this is activated now. When this is weakened, you'll have that.